everyone. We're going to do emergency first aid, standard first aid renewal. This is going to be cardiovascular emergencies, child and infant resuscitation. Definition of a cardiac arrest: it occurs when a person's heart stops beating completely, effectively, no longer circulating the blood to the brain. So this could be atrial fib or ventricular fibrillation, and it could be cardiovascular problems. Signs of a cardiac arrest are unresponsiveness, not breathing, abnormal breathing, and no signs of circulation. CPR stands for cardiopulmonary resuscitation. CPR consists of two life-saving skills: providing chest compressions and giving breaths. When a person's heart stops beating, you need to perform CPR in order for them to stay alive. An adult is anyone going through or is through puberty already. A child is anyone older than 1 year old and has not yet reached puberty. When in doubt, you treat the large child as an adult. The AED is a machine that can detect abnormal heart rates. An AED can deliver a shock to eliminate the abnormal rhythm, allowing the heart to resume a normal rhythm. Now, when we talk about chain of survival, this is the ability to survive a heart attack. Early recognition and activation of the emergency response team, early CPR, early defibrillation, early access to emergency medical services, access to post-cardiac arrest care. This means hospital, okay? So the quicker that you get the EMS there, and the earlier you start the CPR, the better chances of you surviving any cardiac arrest. Recognition and activation. You conduct a scene survey, check responsiveness, tap and shout, activate EMS. If you're alone, you have a cell phone, use a cell phone. Put it on speaker mode and phone 911. They will tell you how to do CPR over the phone. Check for breathing, open the airway, scan the chest for rise and fall. You start CPR immediately. Okay, so CPR is comprised, like I said, of two skills: providing compressions and giving breaths. The better these skills are performed, the better the chances of survival. So make sure they're deep enough, fast enough, full chest recoil, avoiding the interruptions, less than 10 seconds, okay? Give high quality breaths, opening the airway with the head tilt chin lift, 2 breaths over 1 second each. Watch for visible chest rise. Limit interruptions of any kind, less than 10 seconds. Adult chest compressions. You can have a mannequin, or you can just practice on a pillow, in fact. Conduct a scene survey. Make sure the patient's on a firm, flat surface. Kneel beside the patient. Place the heel of one hand on the lower half of the breastbone, then place the other hand on top of the first hand. Your shoulders should be directly over the hands. Now, we can do this on a pillow, or we can do this pretending on a baby. Now, I'm too short here, but if I would have them on the floor, we would do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, okay? And you're going to lock your elbows and use your weight to take and do the compressions. That's on an adult. Keep your elbows straight, push down at least 5 centimeters, 2 inches. Continue pushing at a rate of 100 to 120. This is the same for infant, child, and adult. Push hard, push fast. Do not interrupt the compressions for more than 10 seconds. And that's for when you're breathing and when you're moving them. Mouth-to-mouth breathing practice, working with the CPR mannequin. Practice the steps for mouth-to-mouth breaths. So, with an adult, it's going to be head tilt, chin lift, the same as an infant. Okay? And you're going to make sure that the head is back far enough so that the airway is open. So while you're holding the airway, you're going to pinch the nose closed with your thumb and index finger, as you can see them doing it here. And then you're going to make sure you have a barrier device. Now, when I say barrier device, it can be anything from a fancy mask to something that looks like even this. This is a barrier device. Okay? And it's made out into a keychain. And in this keychain, you get a pair of gloves as well in it. And this one here, I actually got from the Heart and Stroke Foundation. You can buy them at St. John Ambulance, many different other places as well. All right. Do not take longer than 10 seconds to deliver the 2 breaths. All right. And you can see here how they have a different, fancier type of barrier device. The chest doesn't rise with your breaths. If the chest doesn't rise, you allow the patient's head to fall back to where it was, and then just reposition it. And then try again. Use of pocket mask. When you perform CPR, give breaths to a patient. The risk of infection is extremely low. So the pocket masks will have a one-way valve, and so that's why it's extremely low. However, the use of a face shield or pocket mask will help reduce the transmission of any infection. All right, adult mouth-to-mask breathing practice. All right, working with a CPR mannequin and a pocket mask, let's practice the steps for delivering breaths. So, remove the pocket mask from the case, ensure the scene is safe. Fully open, unfold the mask. So you will see that the mask is probably looking more like this, flat. So you push it out so that it's fully open. Place the narrow pointed end at the nose and the wide point at the bottom. As you can see that picture, 2 hands over this way, 1 finger there, and your 2 fingers underneath here, and you blow in. All right? So, index and thumb finger on the edge of the mask. With your other hand, put your thumb on the bottom edge of the mask and place your remaining fingers along the bony part of the patient's chin. So this is the bony part, just like this. All right? Perform a head tilt, chin lift, head tilt, chin lift. You're just lifting the chin, you're not moving the patient at all. All right, give 2 breaths over 1 second each and watch for chest rise as you give the breaths. Okay, so that is the mouth to mask breathing. All right, and so another thing too is when you're doing CPR, your hand, 1 hand here and another there, and you're going to lock your hands and CPR. So 30 compressions, okay, 30, head tilt, chin lift, 2 breaths, 30 compressions, 2 breaths. Oh, all of a sudden, you with the yellow shirt, get me the AED and call 911, okay? Ah, she's off and running. And guess what? We have an AED. Isn't that great? Now, practice the steps for using an AED. With an adult, you're going to put 1 pad here, the other pad's going to be put here. And if you look on your AED, you will see that it actually does give you the pictures of how to put it on an adult. So it'll prompt you to clear the patient so it can analyze the heart rhythm, call out I'm clear, you're clear, we're all clear, and let's make sure that nobody is touching the patient, all right? So, just pretend that the pads are put on, everything's clear, everybody's clear, okay. The machine says, push the red button for
begin by removing all clothing from the patient's chest. Cut clothing if needed.
if needed, okay?
When patient's chest is bare, remove protected cover and take out white adhesive pads.
The white adhesive pads are right here.
When patient's chest is bare, remove protected cover and take out white adhesive pads.
Okay, so you can see how it talks me through it, and if I haven't done something, it'll repeat it.
Adult pads. In case of emergency.
There. Okay, so now it will talk you through everything you need to know about the AED. It'll say, okay, put them on, you know, following the pictures, and then it'll also say, resume CPR after it's shocked. The biggest thing is you have to remember that when you shock the patient, that nobody is touching them. And when it says stop CPR, analyzing, that you stop CPR like it asks you to, because if you're still doing CPR, it'll analyze how good you're doing your CPR, right? So if you're doing a real good job, it won't be analyzing properly. So that is the AED for adult. Now if it was an infant, you follow the same prompts, same thing, except you put one AED pad on the top, one on the bottom. And that's the same with a small child. You can use adult AED pads for the child, but you cannot use child AED pads for the adult. All right, and that's the reason why. Now, you will see that when you get your AED, it'll come with a towelette, and this is for if the patient was wet in a shower, or if they were sweating because they were working out, then you need to dry them off. You'll get a pair of scissors, because a lot of women wear underwire bras, and so if that's the case, you have to cut the bra in half so that the underwire doesn't elude the electrical charge. Okay, and another thing too is that you can't put the AED pads over clothing. It doesn't work. So you have to cut the clothing off. It'll also come with a razor. For those men who are the missing link, who have more hair on their chest than they do on their head, you use the razor to clear off a couple of the spots that you need for the AED, because the AED pads will not adhere to the hair on the chest. Now, if you really want to be mean to that person, you can use the AED pads as a waxing machine. You can wax the hair off with the AED pads, because there's enough wax on there that it will wax the hair. So, but men won't like that too much if they're a little bit conscious. Anyways, so that is the AED. The AED will also come with 2 sets of pads, so if you want to do the waxing, you can do the waxing, okay? It'll also come with a pair of gloves so that you have personal protections, all right? And if you have any questions regarding the AED, please give us a call or email us, and we can really help you with that. So, if the AED tells you to shock is needed, make sure no one is touching the patient. press the shock button. It will actually tell you to press the shock button. Immediately resume CPR, starting with chest compressions after the AED is used. If defibrillation is successful, the patient may resume breathing. You keep the pads in place. Now some EMS people actually have the ability to use the same pads. They just plug the pads into their machine in the ambulance. And so it's very important to keep the AED pads on the patient and that. And another thing too, if you have the ability or have someone that's with you, it's important that you take and write down, okay, we started CPR on this guy at 10:50. The first shock was given at da-da-da, and all that sort of thing. But if you don't, then don't worry about it. But the ambulance people really do appreciate having that information. You may need to reuse the AED pads if the patient's heart stops again. So that's another reason why you want to leave the AED on there. Place the breathing patient on recovery position, continuing to monitor ABCs, treat for shock, and reassure the patient while waiting for EMS to arrive. That's if the the defibrillation was successful. All right? So practice this. If you need to have an AED to practice with, Gianna Centre does have an AED here and a practice AED monitor. So if you want to do that, come on in and we will let you want to practice that. Now, I know that in most malls that they all have AEDs there on the wall, and if you open up the AED, the security will come running, and they're all trained in how to use the AED. So they will probably be there within minutes. Now another thing too is that most of the security, if the AED is opened, it alerts the head security office as well as to, okay, the AED machine is being used. And so then they know exactly which one is being used, so they will dispatch an ambulance for you immediately as soon as the other emergency or the security gets there. And this is in almost every one of the malls. Okay, so what you're going to do, starting from square one, sir, are you okay? Sir. You with the yellow shirt, call 911 and get the AED here as soon as possible, okay? Shout for help, activate EMS, open the airway. Head tilt, chin lift. 2 breaths. Okay? And then hand over fist sort of thing, and you're going to lock your elbows, use your weight, and 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10. Okay? And you're going to do that 30 times, 2 breaths. And then 2 breaths. Use the AED as soon as possible, okay? And after shocking with the AED, immediately resume CPR again. All right? 30 cycles, 2 breaths, using the AED. And you're going to do this as well with the adult until the patient attempts to move, breathe, or speak or react. You are too exhausted, it is unsafe to continue, or EMS arrives and takes over. Okay? So even if the security guard comes and helps you, you should be helping him do CPR. You don't abandon your patient.